So I want to talk to you guys a little bit about communication with our babies. Communication is a vital part of how we're able to communicate and express our needs and our feelings. This is especially true for our little babies and our young children. The major way they communicate at this age is crying. Crying increases in length after birth and really peaks at about 6 weeks of age and can be many hours during the day. They may be crying to let you know that they're hungry, that they're dirty, that they're tired. They may just want to see their mommy and daddy. Sometimes they cry just to cry. That's part of their jobs, and it's something they're really good at a lot of the times. You will really get to know their cries. You guys will become a really great team, anticipating what her needs are. They're not crying because they don't like you. They're crying because they need you, because they want to be with you. At these young ages, you're not going to spoil your baby by holding them too much, by reading to them, by talking to them. In fact, doing so is going to help improve bonding. It's going to help your baby feel safe and help your baby feel secure. Sometimes our babies just won't stop crying. There are many things you can do to help soothe them. I want to talk a little bit about the 5 S's. So this is swaddling our babies when they're really young. It can be placing them in a side or stomach position. They may be shushing them, so it's a loud shush. Shh. We may place them in their swing, of course, securely fastened to their swing. And we may allow them to suckle on a pacifier. Sometimes they just want the bottle with them. Please remember, if we put them in the side or stomach position, we have to have direct observation, watching our kid, because that is an unsafe position, so we need to be watching them. I want you guys to remember too, if you're feeling sleepy, remember to put your baby back in their crib, their bassinet, or in their playpen alone on their back. No pillows or no blankets, please. So there are going to be times when you're feeling tired, you're not feeling well, you're going to be feeling overwhelmed. So if you can't figure out why your little one is crying, if you know they're not sick, they're not dirty, they're not hungry, it's okay to go ahead and put them in their crib or their bassinet on their back alone. I promise you, crying is not going to hurt them, okay? What I recommend in these situations is put them in the safe sleep environment. Do some relaxation techniques for yourself. It could be breathing techniques, something we can practice even when we're doing well. So when we are stressed, when our baby's having a bad day or our child's having a bad day, we're going to be able to get in our relaxed state pretty easily. Practice does make perfect. If you're feeling overwhelmed, call a friend, call your parents, ask somebody to swing by if they're able to, or just talk to you on the phone to help you calm down. It's okay to ask for help. There are some great hotlines out there. The Fussy Baby Hotline, it's 807-705-KIDS, which is 5437. You can call your pediatrician. You can call your insurance nurse line. We will help you. If you do put your baby down because you need a little bit of a break, please check on them regularly every few minutes. Something very important I want to say, it's super duper important. In fact, never ever shake your baby, not even once. This is going to injure your baby. This may cause bleeding in the brain, it can cause broken bones, and it can kill our babies. No baby has ever died from crying. They have died because of parental reactions to their crying. Hi, I wanted to talk to you guys a little bit about bonding. Bonding with our kids is very important for their well-being and our well-being. It's really vital for their brain development, it's vital for their social, emotional growth, and it's very important in them helping them develop secure attachments. First, I want to go through a few things that we don't really want to do. We don't want to leave them alone in their car seat or their bouncy seat for too long. If they do fall asleep in those seats, please take them out and put them in a safe sleep environment on their back without pillows or stuffed animals. Remember, never, ever leave them in a parked car for 1 second, please. And try not to use TV or YouTube really before the age of 3. It's not bonding when we sit with our kids buried in our tablet, our computer, while they're sitting next to us. That is not bonding. And we really don't want you guys to forget tummy time. At first, the kids don't like it. They don't have a lot of strength, but they will get better and they will enjoy it. I promise you. They're really enjoyed if we get down on their level when they're in tummy time, and we could try a lot of different tummy time activities to really improve their strength and get them to enjoy it. It also improves their development. So what bonding is, it's face-to-face time with our babies. It's having shared interactions, and it's actually quite easy to do. As the babies grow into toddlers and older children, it's really about doing things together. It's about developing shared interests. It's about exploring the world together. If you have more than one kid, try to set up some special time together with each of them on a regular basis. Even those few precious moments together will mean the world to both you and your child. As soon as the kids are born, we really should start talking to them. We should start in a smooth, calm voice. We should talk to them while we're holding them, while we're feeding them, or we're just near them. This can include singing to them. Even if you don't sing well, they don't know it, they like your voice. Reading to them, even our little babies who don't understand books, they enjoy that time. When the kids are young, we can start to narrate what we're doing with them, like, hey, I'm making the cereal with you. What time should we take baths? What time should we go for our walk? Just hearing our voice, hearing these words allows them to help develop. Making eye contact with our babies and having good facial expression is very important as they start to learn and understand communication, especially the nonverbal communication, which is going to serve them so well. I really recommend checking out a website called pathways.org for great ideas on development and bonding for our kids from birth all the way up to 6 years. Sometimes, after our baby is born, things get a little bit difficult. We can feel overwhelmed, we can feel sad, and we can feel depressed. This is actually pretty common in both mommies and daddies. Please don't think you're alone. Please don't think something is wrong with you. If you're feeling these things, talk to your support network, talk to your doctor, please talk to the pediatrician. We will listen and we will help. In Arizona, we have a great resource, and it's free. It's available 24 hours a day, called the Arizona Warm Line. The phone number is 602-347-1100. Again, if you're feeling sad or depressed, talk to your doctor, call the Warm Line. Thank you.